Hi, this is Dr. Jonas Leibowitz, an endocrinologist with nearly 30 years' experience, here to talk about an introduction to the complications of diabetes. The reason we treat diabetes aggressively and the reason we want to try to avoid getting diabetes and take care of our sugar results when we have prediabetes is to avoid complications. We like to divide the diabetes complications into microvascular and macrovascular disease. Microvascular meaning the small blood vessels, and macrovascular meaning the larger blood vessels. The common microvascular complications involve diabetic neuropathy, which means damage to the nerves. Most people know it as having numbness or tingling or funny sensations to their feet, maybe a loss of sensation to the feet. Diabetic retinopathy, which is diabetic eye damage to the blood vessels and the nerves of the eyes, and diabetes is the leading cause in the United States of blindness. And then also diabetic nephropathy or diabetic kidney disease. And diabetes is the leading cause of dialysis in the United States, and that involves damage to the blood vessels to the kidneys. Macrovascular disease, the larger blood vessels, relates to having heart attacks or coronary artery disease, clogging of the arteries. And when we talk about atherosclerosis, we mean the macrovascular issues like heart attacks, clogging the arteries, needing a stent or a balloon or a bypass surgery, as well as for the development of heart failure. We also talk about strokes, which involve clogging the arteries to the brain, and that's also a macrovascular event or large vessel disease. And thirdly, we talk about peripheral arterial disease or PAD, which involves clogging the arteries that go to the lower extremities of the legs, which can contribute to wounds that don't heal and can also contribute in combination with neuropathy to the development of wounds. And also in the United States, diabetic neuropathy plus peripheral arterial disease contributes to amputation, and diabetes is the leading cause of amputation in the United States. In further videos, we will go over these complications in greater detail.